Motion's made and seconded that House concur in Resolution 5, taken from its place in the orders of the day, read for the third time by title and sponsor only, and placed upon its passage. Mr. Clerk, please report.
House Concurrent Resolution 5, a concurrent resolution calling for the expediting of research regarding the safety and efficacy of the use of marijuana for medical purposes. Representative Endley.
Gentleman from McCracken.
Mr. Speaker, I yield to the gentleman from Greenup 98 for explanation of the bill and motion thereon.
Chair recognizes the gentleman from Greenup 98 for explanation of the bill and a motion thereon.
Thank you, Mr. Speaker. This is my fourth year to bring this resolution out in front of most people. Most people know what is in it. It has been updated, and every fact in there has been documented. I wrote it as a term paper. So if anybody wants to know my sources, I have them with me. But to talk on, I want to give you a little history about cannabis. It started 8,000 to 9,000 years ago in China. As it made its way across the continents, it came into the United States through Mexico. But it's always been there. It was found in the campsites of the barbarians, the seeds were, so it's been around a long time. In this country, in 1890, we had the progression of the golden age of microbiology. So science has developed overnight. Everything from immunology, parasitology, microbiology, all those things. So man learned to enlighten himself. So through the years, and our tragic things like thalidomide and sulfanilamide, we have asked for safety and efficacy by us knowing more scientific methods and asking for the basic research behind them. In 1936, there was a movie made called Reefer Madness. You can watch it on YouTube. It's in black and white. But today, in 1973, we developed the ability to measure a nanogram. That's 1,000th of a milligram. And by doing that, we can tell about the administration, metabolism, excretion of and distribution of any chemical in the body, called pharmacokinetics. So it's come a long way since then. The ability to do that has given us the ability to discover there's two receptor sites in the brain, one in the front part of the brain and one in the gut, CB1, CB2, and that there's different strains of the cannabis. The different strains have increased in strength by making them females, where they're not females, it makes the source of the plant stronger. So after 1973, we realized that there were drug interactions with the THC and CBD. And then the term medical marijuana came out, and the term medical marijuana means the whole plant. So there's about 600 compounds in the plant, about 60 THC type compounds. So to this point, it's been a Schedule I drug, and so there's been little research. In May 17th, last year, 2019, several Congress members urged that there'll be studies on pain and stress. And that was the two main things they wanted to use this compound for. We have learned that there's some more adverse reactions since then too, like the hyperemesis syndrome or the just the plain use disorder, the effect on IQ, schizophrenia, and so forth. And most people, if you read through that resolution, you can see the facts. And like I say, I have every line documented. But what is interesting is that by our persistence with this resolution, we're getting results. There's 4 phases to study of a drug. You get a new drug application, and you get a little bit to determine dose and population, phase 1. And then it expands, phase 2, phase 3, and phase 4. There has been a study, by the DEA, Federal Department of Agriculture, and at Yale University in the med school. It is a phase 1 study. The marijuana will be produced in the United States, and I think that is a big step forward, because in our resolution here, we asked those institutions to do this. So we haven't been doing this in vain. It is real now. In November 2019, we now have a phase 1 study in the United States by the cannabis being grown in the United States. I think that's quite an accomplishment by just sending letters to the FDA. The DEA is still dragging their feet, but what this resolution does is tell them that the state of Kentucky is still interested in the safety and efficacy of this product and for the safety of the Commonwealth. And with that, Mr. Speaker, I move for passage.
Question before the body is passage of House Concurrent Resolution 5. Is there any discussion? Chair recognizes the gentleman from Jefferson 33 for discussion of the matter.
Thank you, Mr. Speaker. I'm rising in support of this resolution. I think it's important, and we agree, those who support medical marijuana coming to Kentucky, that research is important to protect our people, that we need to expedite that research so that when we bring medical marijuana to Kentucky, hopefully very soon, that it's safe for our folks. We want research and we want it to be expedited. But I also want to be very clear that this in no way, in my view, is a delay on the necessity that we pass medical marijuana this session. And so I'm supporting this bill. I do not see it as a delay to House Bill 136, which is making its way through the process, carefully, cautiously, slowly, but making its way through the process nonetheless. We want research. We support your resolution, gentlemen from Greenup, but we also want medical marijuana this session, and we're going to hopefully bring forth House Bill 136 alongside your resolution. So with that said, I'm voting for a yes here, but I don't see it as a delay to bringing medical marijuana to Kentucky. Thank you, Mr. Speaker.
Thank you, gentleman. Chair recognizes the lady from Jefferson 38 for what purpose, ma'am?
Thank you, Mr. Speaker. Will the gentleman yield to a question, please?
He will yield.
Thank you, Mr. Speaker. Gentlemen, like you said, we have considered this resolution before, and I think last year I did vote against it, but in reading through it really quickly, I didn't see what I saw last year, which is language saying that Kentucky should not pass medical marijuana or any legislation on marijuana until this research is completed. Is that same language still in this resolution we are considering today?
Gentleman from Greenup.
I couldn't hear, Speaker.
Lady, would you like to rephrase your question?
That's the first time that's ever happened, Mr. Speaker. Gentleman from Greenup, like you said, in previous years, we have considered this resolution. And in considering that resolution last year, I think there was very explicit language in there saying Kentucky should not pass medical marijuana until this research is completed. And I have read this resolution as it is today, and I do not see that language. Am I correct about that?
You are correct.
Gentleman from Greenup.
She is correct, Speaker.
Lady from Jefferson.
Thank you, Mr. Speaker.
Chair recognizes the lady from Jefferson 35 for discussion of the matter.
Thank you, Mr. Speaker. Will the gentleman yield to a question?
He will yield.
So I support what the two speakers prior to me have said, that this is not inconsistent with legalization of marijuana. I want to clarify, I believe that there are states where medical marijuana is already legal that have also passed a resolution like this. Is that correct?
Yes.
Gentleman from Greenup.
Yes, Speaker. Yes.
Do you
Lady
know?
from Jefferson.
Oh, sorry. Do you happen to know what those states
Would
are?
you like to ask
I don't.
another question, lady from Jefferson?
Sorry, Speaker.
He will yield to another question.
Thank you.
I couldn't
Direct
even
your comments to the
exactly.
chair.
I do have them on me, but I don't run on the top of my
Okay.
head.
That's it. Thank you very much.
Chair recognizes the lady from Fayette 76 for discussion of the matter.
Thank you, Mr. Speaker. I agree with the gentleman from Jefferson 33. I support House Bill 136 and am a co-sponsor, but I will be voting yes for this resolution. Thank you, sir. Thank you, Mr. Speaker.
Thank you, lady. Chair recognizes the gentleman from Fleming 70 for discussion of the matter.
Afternoon, Mr. Speaker. How are you today?
Well, thank you.
Good. I've been working on this medical marijuana bill for 4 years now, and my colleague from Jefferson beside me here.
Would you like to speak on the bill, sir?
Please, if you would, it'd be good.
You're recognized to do so.
We've put in hours and hours, and we've been over research and research and research. I support the gentleman from Greenup's resolution today. I'm going to vote yes on that. But it's time in this body we take a stand and start moving Kentucky forward in the right direction, in my beliefs. Thank you very much.
Thank you, gentlemen. Chair recognizes the gentleman from Fayette, 45, for discussion of the matter.
Would the gentleman yield to a question?
He will yield.
Gentlemen, thank you for bringing this resolution. I intend to support it this year as I did last year. I had one question I wanted to ask, and can you hear me? Can you hear me now?
Would you like to ask another question, gentlemen?
Why, Mr. Speaker, I didn't know you were paying attention, but yes, I would.
He will yield to another question.
Thank you, Mr. Speaker. How gracious of you. Gentlemen from Greenup, are you aware of any other medical drug that's been allowed to come to the market to use without going through the full FDA approval process and has caused adverse results for patients?
Gentleman from Greenup.
The first part of that question is, has it went through the FDA process? And the second part is what, Stan?
Gentleman from
Gentleman?
Fayette.
Fayette? I'm sorry.
Mr. Speaker, may I just break that up into two questions?
You may ask
right.
a second question.
Question, are you keeping a scorecard up there? All right, the first question, gentlemen from Greenup, are you aware of any other drug that has been allowed to come to the market for use with patients without going through the full FDA approval process, say in the last 50 years?
Gentleman from Greenup.
To have a legend on it which says this drug can only be filled by prescription, no.
May I ask another question?
Yes, sir.
And all kidding aside, gentlemen from Greenup, in the past, I know that there have been medications that have been used prior to really the FDA getting fully involved and fully engaged in testing drugs that have caused adverse effects to children and other users. Not to really bring up a sore subject, but there was a drug that was used years ago when delivering babies that resulted in babies having shorter limbs. They were referred to as flipper babies. And that was a result of a drug that was allowed to come and be used without going through this full process. And my question is, are you aware, in the last 50 years, has this country, as the FDA, as the United States government, allowed any other drugs to come to market without going through this process, which may have caused these type of adverse reactions?
Gentleman from Greenup.
In 1937, there's sulfanilamide. It was labeled as an elixir. The word elixir meant it contained alcohol. When they went to the product, it was distributed in a glycerol, which wasn't a true alcohol. So it was pulled from the market for safety reasons. The drug you referred to was in the 60s with thalidomide, which was used for depression in pregnant women in London, produced the flipper babies. So that tragedy caused efficacy or effectiveness to be produced in the drugs. When the HIV virus came out, the AZT was put on the market in 16 weeks, but it still went through the testing. So they can hurry up the process, but that's probably the history. My concern is that the more we do biological products, that we may still have a biological problem in the future where we have to go in and make our teeth stronger.
Gentleman from Fayette.
Thank you, Mr. Speaker. And with your indulgence, may I ask him just one more?
He will yield to another question.
Thank you, Mr. Speaker. Gentlemen, I don't know the answer to this. I've read about it. I don't know if it's accurate or not, but it's my understanding that over the years, say the last 20, 30 years, that people have maybe been illegally growing and using marijuana, that there are actually different strains of marijuana that have different strengths of the drug that I cannot pronounce, THL or THC, whatever it is. And what I want to know is that still accurate? the states that have legalized medical marijuana, is there a standard that the marijuana has to have X amount of THC in it for medicinal purposes? Has that been developed yet?
Gentleman from Greenup.
Well, our hemp law said you had to have 0.3% per dry weight for it to be industrial. But if you go across the country, you can go out to California and they have a product called sour diesel. Probably the percentage of that is probably 50 to 60%. It's so pungent, that's where it gets its name from. But some people have children with seizures, went for Charlotte's Web, which is another name, which was a smaller potency, and they used it because they didn't want all the untoward side effects of high THC. CBD right now, of course, we have pure CBD that's been approved by the FDA. No THC products have ever been approved, but on the open market or the black market, you cannot guarantee those concentrations, and that's where people are at more risk. People say that there's no deaths from marijuana, but when you go out and you tell the public there is no deaths, it's like producing those low-tar cigarettes again. They just smoke more of them, but what it does, it increases the risk of having the untoward side effects of the marijuana when you go out and say there's no deaths from it. And also, about 5 weeks ago, the THC has a drug interaction in the liver with the cytochrome P453A-C, and it's the same enzyme that metabolizes Coumadin, which is warfarin, a blood thinner. Most of you know it as rat poison. So it's an inhibitor, so that person hemorrhaged because they were a chronic THC user. Now, out in Hollywood, California, Cedars-Sinai is a sister to Mount Sinai, and they started seeing the people come in with cannabinoid hyperemesis syndrome through their ERs. These people were vomiting and screaming at the same time, so a new term came into society called scromiting. At first, they put these people in a hot shower for 6 hours. Then they realized they could put hot pepper cream on them like you all buy for arthritis and cover their bodies with them and reduce those symptoms of them being that way. So if you're screaming and you're vomiting, you have the ability, if you're not taken care of, to dehydrate. And so this was a bad syndrome caused by the receptor sites being fully engaged. So when these people would go home and not use any marijuana, they thought they were recovering, but they didn't. They went right back to the same situation. So that's another reason we need more research, because things like that are coming into exposure. I've seen tubules of THC that said 90% on it. And of course, with the vaping problem also, we realize that anything in the oil that goes into your lungs as smoke is going to cause lipid pneumonia. In other words, it goes into smoke and then it forms an oil, and then your white blood cells attack that oil. It's the same as you having kerosene in your lungs. And also, with the smoking, smoke causes COPD. So that's another thing we need to look at too with smoking of it.
Gentleman from Fayette.
Comment on the measure, Mr. Speaker?
Yes, sir.
Thank you, Mr. Speaker, and thank you, gentlemen, for those comments and that explanation, most of which I followed. Candidly, I didn't follow all the science, but I did follow some of it. I think there's everyone on this floor, if I asked for everyone to raise your hand, everybody on this floor would say, we want to do something to help our people. Everybody would say that. And everybody on this floor would say, you know, if true medical marijuana, whatever that eventually becomes and is, if that would help our people, I think most people would be supportive of that. But what you've just told me and what you've just explained to the whole body is there are risks with a substance that has gotten progressively more powerful and more potent over years and can have adverse effects. And I think if I asked for another show of hands, everybody on this floor would raise their hand and say, we don't want to do anything that could potentially hurt our people. Even people who are suffering with seizures, pain disorders, stress, anxiety, even glaucoma. Everybody would raise your hand and say, we don't want to do anything to hurt them. We don't want to do that. So I don't view, Mr. Speaker, this bill or resolution as delaying the process. I think it's a process that we need to go through because this is a big step. I think that people sometimes, and how it starts, they want to legalize medical marijuana, then they want to legalize recreational marijuana. And I can tell you from personal family experience that marijuana can get a hold of you like any other drug, and it'll take you places you don't want to go and make you do things you don't want to do. And I think we need to be cautious about that because this is a change. And I've seen it destroy lives in my family. So I don't view this as delaying anything. I view this as something that needs to be controlled. I mean, my gosh. It's been illegal for years. There's a reason why it was originally made illegal, ladies and gentlemen. It wasn't just on a whim. And I think we need to be cautious, and I congratulate the gentleman. I'm glad he ran for office and was elected because he's clearly the most knowledgeable person we're ever going to have in this body, I believe, without fear or contradiction, who knows enough about all this. So I think we all ought to support this. And hopefully the FDA will review this. And they'll come up with a set of standards and something that we can do that won't harm our people. So I would encourage everyone to vote for this, and thank you for indulging me.
Thank you, gentlemen. Chair recognizes the lady from Kenton 64 for discussion of the matter.
Thank you, Mr. Speaker. I'd like to speak on the bill.
Yes, ma'am.
Of the resolution. I agree wholeheartedly with the gentleman from Fayette 45. Thank you for being so articulate, something I am not right at the moment, about this issue. I agree wholeheartedly that we need more research on this topic. I think that Kentucky has a real opportunity to be a leader in research on hemp and cannabinoids, cannabinoids, medical marijuana. I think that there remain serious questions about the efficacy, the dosing, the indications, and the contraindications of a plant that we don't quite and fully understand. And so I wholeheartedly endorse this resolution and support this. And I would like to take this a step further as well and really promote research in Kentucky. I would like to keep working on this, actually. And I really believe that there are so many questions that we don't have answered about the medicinal qualities. I think that we should proceed with caution. I don't necessarily believe that legislatures should be in the business of voting on medicines. This is not the process that we have. We have an FDA approval process, and any other plant that becomes a medication has gone through this process. This is the safety and the protections that we have in place. So I would just urge support of this resolution and further research. Thank you, Mr. Speaker.
Thank you, lady. Chair recognizes the gentleman from Breathitt 91 for discussion of the matter.
Thank you, Mr. Speaker. And I want to compliment and thank the gentleman from Greenup for bringing this forward. We do need to research any drug, as the gentleman from Fayette indicated as well. But I'm going to do something a little different that was not been done here today. I'm going to advocate some for the patients who need medical marijuana. The patients who come into my office sick, the patients that have to go to other states. And the gentleman from Jefferson 33 is correct. We can keep studying anything, and we can study and study and study. And I would tell you people that are so concerned about drugs, go read the book Dope Sick, written about the introduction of opiates into Virginia. They were marketed, Mr. Speaker, Oxycontin was marketed as non-addictive by big pharmaceutical companies, and residents were giving a 90-day free supply of Oxycontin. So if you all are really concerned, start advocating some for the patients. Thank you.
Chair recognizes the gentleman from Jefferson 30 for discussion of the matter.
Thank you, Mr. Speaker. I'm probably the only one in this chamber that voted to criminalize the use of marijuana. And the reason we did it, it was politically popular at that particular time. We did not know enough about what marijuana did or anything else. It's probably the worst vote I ever cast since I've been here in my 47 years. But I've had over 120 people come to my home who were crippled, and the only thing that helped them, they were given medication by doctors, and all they didn't do anything for them. But when they got access to marijuana, it did help them relieve the pain that they were receiving at that particular time. And some of the people that came to my house, they couldn't move their hands. Some of them couldn't even stand, and yet the marijuana did help them. There are certain things in marijuana that are useful to us, and I think we should quite frankly, we should legalize it, because I can go on my street and find marijuana 4 houses from me. So, you know, it's not like it's not out there. But medical marijuana helps people, and it helps them in the best way, and I do encourage you to vote for this resolution.
House come to order. Chair recognizes the lady from Muhlenberg for discussion of the matter.
Thank you, Mr. Speaker. Would the gentleman yield to a question?
He will yield.
Gentlemen, this should be easy. It's your opinion. Would you just give your opinion as to why you think the FDA has been dragging their feet and not schedule it so that it can go through the process?
I think it's because, thank you, Mr. Speaker. It's because it's Schedule 1. If you move it to Schedule 2, all the research will be made in the United States. And I think resolutions like this are going to the Institute of Health and to the FDA are going to push them that way. There's congressmen there, I know about 40 in Washington are going that way right now. So if you make THC Schedule 2, it would open up all the research being done in the United States. Because basically everything comes from Israel or Canada on the research.
Lady from Muhlenberg.
May I have another question, please?
He will yield to another question.
What would it take to get it rescheduled, reclassified?
Well,
Gentleman from Greenup.
Mr. Speaker, it goes to a docket through the DEA. The last docket they did I have with me, but the DEA evaluates everything from international law to the abuse of it, to if it's habit forming, to the pharmacokinetics of it, and then they make a decision.
Thank
Lady
you,
from
Mr.
Muhlenberg.
I intend to support this measure, and I encourage folks to contact their federal legislators. Thank you, Mr. Speaker.
Chair recognizes the lady from Meade for discussion of the matter.
Mr. Speaker, the gentleman from Greenup, yield to a question, please.
He will yield.
Gentleman from Greenup, we've had some conversations about this, but are you familiar with any medical marijuana products that are currently on the market that have been approved by the FDA?
Yes.
Gentleman from Greenup.
I have the list of them here with me. Let's see. Sesamet is the United States with Marinol. I was in business when Marinol came out for nausea and vomiting, and it's synthetic THC. And it came out of Schedule 2, and they had a big fear that people would get the buzz or stoned or high or whatever from the product. It didn't happen. So they moved it back to Schedule 3, and I lost money on it because I had sent back a outdated product, and it was Schedule 2, so I spent a lot more money on it. So Marinol's still out there. State-of-Ec is made in England, and it's used for multiple sclerosis. And of course, we just had the one for the glaucoma Epidiolex from England. Of course, GW there in England produces all those products. There's a few hybrids that are produced, but they're mostly black market. There's one I know now that some people are using for epilepsy. It's a nasal spray. And probably the reason it's so effective is because if you go through the nasal mucus, those receptors in front of the brain, it's probably going straight to it and you get a high dose through the mucous membrane of the sinus. But a lot of more research needs to be done. So those are the products that are on the market.
Correct. Lady from Meade.
And we've done enough research to realize it's about 5 nanograms per deciliter that makes you inebriated with marijuana, let's put it that way. So
lady from Meade.
Thank you, Mr. Speaker. Thank you, Mr. Greenup.
Chair recognizes the gentleman from Jefferson 46 for discussion of the matter.
Thank you, Mr. Speaker. Would the gentleman entertain a question, please?
He will yield to a question.
Gentlemen, first of all, do support this measure. The question is, do we not have a senator in Kentucky that recently led the charge of getting hemp rescheduled in this country recently?
Gentleman from Greenup.
You mean industrial hemp?
Gentleman from Greenup.
Yes.
Well, there's several congressmen. That's the ones I've been keeping up with.
Gentleman from Jefferson.
Would the gentleman entertain another question, please?
He will yield to another question.
Gentlemen, have you ever had a conversation with the senator of Kentucky who led that rescheduling for industrial hemp about rescheduling marijuana?
Gentleman from Greenup.
You mean face to face? No, sir.
Gentleman from Jefferson.
One more follow-up question, please.
He will yield to another question.
Gentlemen, do you think it might be a good idea to have that conversation or send a letter to that gentleman to see if he would be interested in taking on that measure?
Gentleman from Greenup.
I think we ought to put his address on this resolution.
Gentleman from Jefferson.
Thank you. May I speak on the measure, please?
Yes, sir.
Ladies and gentlemen of this body, our biggest issue with cannabis across this nation is exactly what the gentleman from Greenup is talking about. It's the way it's scheduled. And because of the way it's scheduled, we are limited on what kind of research that can be undertaken. We've known this for a long time. And basically what's going on is we're tired of waiting. And the states are taking this in its own hands in order to get certain treatments to certain people. But we need to get this done for a variety of reasons. First of all, the trend is going in that direction of legalization, decriminalization. If it was really that awful of a substance, don't you think we would have known by now? It's been around a long time. However, research is needed so we can figure out the best ways to administer this product and the best ways to limit some of the side effects that may be there. So I urge you today to support this measure, but I also urge you to do whatever you can to try to get this rescheduled at the federal level. Rescheduling can do a lot of things. It can also open up interstate commerce of a product from legal state to legal state. And even if we had a medical cannabis program in this state, I hear we could be a good export state for this product if that were to ever occur in the future. So please support this measure today, and it'd be a step in the right direction. Thank you, Mr. Speaker.
Chair recognizes the lady from Letcher for discussion of the matter.
Thank you, Mr. Speaker. I plan to vote yes on this resolution, and I appreciate the gentleman for bringing it, and I appreciate his knowledge and expertise in this matter. But I would say that by now, knowing that 33 states have legalized medicinal marijuana, that the first of those was done in 1996, that we have had a lot of time by now to know that this is a helpful thing to do for our people, and that there are sick people in our state, there are sick children in our state, there are veterans with post-traumatic stress disorder, and there are addicted people who can use medicinal marijuana to help alleviate their substance abuse disorder, and that it's time we stop ignoring those people who are waiting for us to give them some relief.
Chair recognizes the lady from Jefferson 40 for discussion of the matter.
Thank you, Mr. Speaker. I rise in support of this resolution, and I am a co-sponsor of the gentleman from Jefferson 33's medical marijuana bill as well. I did want to make a point and maybe answer a question that the gentleman from Fayette had earlier. Marijuana was legal in this country all the way up until the early 1900s. The reason that it's been prohibited until this time has less to do with the efficacy or the dangers of it, of the plant itself, and more to do with the attitudes and the crackdown that was in place for Mexican migrants at the time, and the attitudes that we had towards immigration in general. And we're seeing a revival of those attitudes here today, but I just wanted to point that out, that we need to understand the history of migration and of marijuana here in our country. Thank you.
Question before the body is adoption of House Concurrent Resolution 5. Is there any further discussion? Seeing none, clerk will sound the chimes. Those in favor vote aye. Those opposed, nay, and the roll call machine is open for your vote. All members voted. Does any member wish to change or explain their vote? Chair recognizes the lady from Jefferson 38. Lady from Jefferson 38 for explanation of vote not to exceed 2 minutes.
Thank you, Mr. Speaker. I'm explaining a yes vote, which is different than the vote that I cast on this resolution last year. And the reason for that is I, of course, believe in science and I believe in research. And as I alluded to when I asked the gentleman from Greenup a question, both times that I asked it, this language is different. The language in last year's resolution said that the General Assembly should not pass medical marijuana until this federal research is complete. This year's resolution talks about adopting more sound practices around marijuana, and I think that would apply whether we pass medical marijuana in this chamber or not. So I believe that a yes vote today is consistent with supporting science and research and supporting House Bill 136, which I do. So thank you, Mr. Speaker.
Chair recognizes the gentleman from Jefferson 43 for explanation of vote not to exceed 2 minutes.
Thank you, Mr. Speaker. Rise to explain my yes vote, not only to support the gentleman beside me, my twin brother, but to make it clear that this is an important step forward. That flew over. Some people say this is an important step forward. The conversation about legalization in general has become very politicized, and people get in their corners. And the response to the gentleman from Greenup to remove the language that says there should be any delay is important. I also think it's important to elevate the history and understand the racial connotations between using the word marijuana in general. And I'm thinking about my good friend, Mr. Gatewood, in this moment. And in jest, I know there are a lot of researchers in short view of me. But we do need to study. We need to have research, but we also need legalization, and we need decriminalization. And I look forward to working with all of you to do that. So I'm voting yes today.
All members voted. Clerk will take the roll. There being 89 members voting aye, 2 members voting nay, House Concurrent Resolution 5 is adopted.